But most importantly, Sean, these tactics, by modernizing American medicine, will allow us to deal with the waste, fraud, and abuse that you alluded to earlier. And let me give you some numbers. It's going to keep you up tonight. First off, just a couple right off the, this is right out of the oven, these ideas. And it's remarkable how many of these problems have persisted for years. Last year, we had 230,000 Americans who were on the Affordable Care Act, the Obamacare plans, who didn't know it. They found out when the IRS agents called up and said, you know, you guys have this free program in your family. Did you know you have it? Brokers had given them these programs, made money off the U.S. government. They had no idea it had happened. The state of California has taken tens of millions of dollars from the federal government, providing free health insurance for illegal immigrants in California. We're going to get that money back. Where there are programs like this that we're witnessing day in and day out, where Medicaid patients are enrolled in multiple states, and the federal government doesn't know about it. So we pay every state for the same person, and we're not getting our money's worth, but those people aren't getting their health either.
In March 2025, the Senate confirmed Dr. Mehmet Oz as the new administrator of the Centers for Medicare and Medicaid Services, twice CMS, bringing with it renewed scrutiny of fraud and abuse in government-administered health insurance programs. His confirmation hearing, held before the Senate Finance Committee on March 14th, featured a notable exchange with Senator Elizabeth Warren, during which Dr. Oz publicly agreed on the need to rein in widespread Medicare Advantage fraud. Warren specifically called attention to upcoding, a tactic where private insurers pad patient records with additional or exaggerated diagnoses to inflate the reimbursement they receive from the federal government. Oz acknowledged that curbing these billing abuses would likely be a more rational way to improve health outcomes than slashing funding for Medicaid, a program he notably avoided committing to protect during that same hearing. According to MedPAC, the Medicare Payment Advisory Commission, CMS overpaid Medicare Advantage insurers by approximately $83 billion in 2024, largely due to upcoding and favorable selection, a process by which insurers attract healthier patients while gaming the risk pool to their benefit. Despite his public stance, watchdog groups have flagged concerns over Oz's potential conflicts of interest. He previously served as a paid promoter of Medicare Advantage plans on his television program and became a licensed insurance broker through TZ Insurance Solutions in nearly every U.S. state, allowing him to directly sell these plans to his audience. A New York Times investigation in February 2025 revealed that UnitedHealth, one of the largest Medicare Advantage insurers, had financial ties to Oz through various media and consulting relationships. His combined business and family enterprise holdings are estimated between $90 million and $335 million, some of which stand to gain from policy decisions made under his leadership. Beyond Medicare Advantage, CMS itself released a press statement on March 10th, 2025, admitting a surge in improper enrollments in the Affordable Care Act, ACA marketplaces. This followed an increasing number of consumer complaints in late 2024 from individuals who discovered they had been signed up for coverage without their knowledge or consent. CMS reported that between 4 and 5 million individuals were improperly enrolled in subsidized ACA coverage during 2024 alone, potentially costing taxpayers up to $20 billion. The rise in unauthorized sign-ups appears to correlate with temporary increases in federal subsidies that began in 2021 under the American Rescue Plan. CMS noted a troubling spike in applications with identity or income mismatches, cases where federal data sources could not verify the information submitted. In 2020, such mismatches numbered 2.6 million. By 2022, that number had more than doubled to 6.3 million. A focal point of this problem involves enrollees who reported incomes between 100 and 150% of the federal poverty level, FPL, qualifying them for fully subsidized ACA plans with 94% actuarial value. A March 2025 report by the Paragon Institute titled "The Great Obamacare Enrollment Fraud" noted that in 9 states, Alabama, Florida, Georgia, Mississippi, North Carolina, South Carolina, Tennessee, Texas, and Utah, the number of people claiming eligibility in this narrow income range far exceeded the number of individuals believed to actually fall into that category. In some states, ACA exchange signups in this bracket were up to 30% higher than plausible demographic estimates. The report questioned how this mismatch could occur without intentional manipulation or large-scale misreporting. Critics argue that brokers and third-party navigators may be fabricating income levels to maximize subsidies and commissions. There is also concern about the role of unlicensed or rogue insurance brokers. CMS has not released data on enforcement actions, but internal sources have confirmed that some brokers are under review for allegedly enrolling consumers without proper authorization. Complaints range from consumers discovering they had insurance policies they never applied for, to others being unable to file taxes properly due to mysterious 1095-A health insurance tax forms appearing unexpectedly. The extent to which these actors are manipulating the system remains under investigation, and so far no criminal charges have been publicly filed. CMS has hinted at possible regulatory enforcement, but has not announced any formal probes. To address these issues, CMS published a proposed rule in March 2025 that includes identity verification enhancements, data matching reforms, and new consent protocols. Among the rule's goals is to protect people from being enrolled in marketplace coverage without their knowledge or consent, promote stable and affordable health insurance markets, and ensure taxpayer dollars fund financial assistance only for the people the ACA set out to support. CMS estimates the changes could reduce improper spending on advanced premium tax credits by $11 billion to $14 billion annually by 2027. However, the success of this rule hinges on political support, regulatory enforcement, and cooperation from insurance companies and brokers, many of whom profit under the current system. One viral claim circulating in media and social channels that 230,000 Americans were enrolled in Obamacare plans without even knowing it has been widely misunderstood. The figure appears to originate from a CNN article in December 2019 referencing general enrollment figures for the 2020 benefit year. Nowhere in that article is there a mention of unauthorized or involuntary enrollments. While CMS has since acknowledged actual cases of unknowing enrollment in 2024, the 230,000 figure predates the current fraud timeline and should not be conflated with recent developments. Still, it reflects a broader confusion among the public about ACA complexity, consent standards, and who is responsible when something goes wrong. Oz has continued to promote fraud prevention as a key focus of his tenure. However, he has been notably silent on whether he will support new funding for anti-fraud enforcement units within CMS or the Department of Justice. Critics argue that without such funding, proposed rule changes may simply act as window dressing. At the same time, several healthcare policy organizations have questioned whether Oz's connections to Medicare Advantage marketing partners, including past promotional deals, could compromise his neutrality. Consumer watchdogs like Protect Our Care and Common Dreams have referred to him as a healthcare grifter, raising ethical red flags about whether he should be in a position to regulate programs from which he has previously profited. Meanwhile, legal analysts have noted that some of Oz's affiliated firms, including those involved in Medicare-related advertising, may soon be subpoenaed as part of a broader fraud investigation being considered by the House Energy and Commerce Committee. No official inquiry has been announced, but multiple committee staffers have confirmed that hearings are being drafted for the summer legislative session. For its part, CMS appears committed to acknowledging the scope of the fraud problem. While the agency has not publicly admitted fault for the failure to prevent improper ACA enrollments or Medicare Advantage overpayments, it has characterized 2025 as a transitional year and pledged to roll out new accountability mechanisms. Whether those changes will come in time to prevent further abuse remains uncertain. What is clear is that the U.S. healthcare bureaucracy is in a state of flux. Billions of taxpayer dollars are flowing through systems vulnerable to exploitation, and the person now overseeing those systems is a public figure who has profited handsomely from them. As this story continues to evolve, further developments, including enforcement actions, congressional hearings, and internal CMS audits, will determine whether the 2025 fraud revelations mark a turning point or merely another cycle of crisis and cleanup. Either way, the systems at the center, Medicare Advantage, Medicaid, and the ACA marketplaces are once again under the microscope, with public trust, industry profit, and taxpayer dollars all hanging in the balance.